Welcome to Straight from the Source with Haley Watts, and our guest today is Butte County Public Health Officer Dr. Jarett Beaudoin. Welcome.
Wonderful. It's great to be here, Haley.
So you are relatively new to Butte County, right? What drew you to this area?
Yeah, that's right. You know, not only am I new to Butte County, but I'm kind of new to California
Okay.
in general. My wife is from the Central Valley, so we knew that we were going to come out here. We met on the East Coast doing medical training, just like in the TV shows.
Yeah.
And so we came out after that. We were looking at the Central Valley and then kind of looking around. I wanted to do public health.
Okay.
And I found Butte County.
So even when you were pursuing medical school and everything, you had it in your mind that you wanted to do public health?
Definitely. Like most doctors, they go through medical school and then
Yeah.
they go on to do advanced training. People call this residencies.
Right.
I did family medicine and then preventive medicine. So
Okay.
I specifically went into a program that teaches you about public health.
Right.
So they teach you all this other interesting stuff that most doctors don't get to learn, like, how do waterborne diseases spread through water, for example.
Yeah. Waterborne diseases, that's something that never really came to my attention until I moved up here and I started realizing all the beautiful, wonderful waterways. I always used to say one of the reasons I fell in love with Chico was 1 mile, right?
Yeah.
Like what a cool thing, like the
Oh my
Sycamore
gosh.
Pool. My family loves Lake Almanor. But then I started hearing about like all the interesting things, like what was it, the swimmer's itch at Lake Almanor,
Yeah.
like, oh, you got to go shower off because of that. And of course, right now we're dealing with the E. coli situation.
Yeah.
Waterborne diseases, I mean, that's common in any natural body of water.
Yeah, if a natural body of water had the normal amount of bacteria, not any additional amount, we would still expect people to get sick
Right.
from the water because it's not like you're drinking water. It has E. coli
Right.
in it. There are animals that are living in the water, and so there's going to be that bacteria, and so
Yeah.
there's always going to be a little bit of risk
Right.
for getting sick when you decide to go swimming.
Okay, so Shigella was a thing last year, I
Yeah.
think, for Chico. And then this year, the big story has been the E. coli when it comes to waterborne issues. I think that a lot of people assumed homeless encampments. That was just this go-to, oh, it must be because of that. That's not what you're thinking, though, right now.
It's not. We haven't ruled out anything, and certainly that was on our radar. I came to Butte County, and specifically Chico. I moved to Chico. I live near the park.
Okay.
And people were all telling me, oh, there's a lot of homeless people who live in the park.
Yeah.
It's a beautiful park. And we thought that could be the case. And then I talked to about 7,000 experts. And, a lot of these experts were like, we don't usually see it in humans. It usually comes from some large animal, a ruminant like a cow or a deer.
Yeah.
So it's very rare to be humans. Not to mention, we just haven't had any human cases.
Right.
So a lot of that evidence starts piling up. So we really don't think it is. Now,
Okay.
if someone, tomorrow came and they were like, we've actually been camping here and we have this disease and we can show you the positive, then
Yeah.
I'd change my mind. But
Okay, so we saw this press release that was put out, right? And it was
Yeah.
talking about testing of geese. I mean, where are these geese coming from that you're testing?
That's
Where are
a-
the animals?
That's a great question. No one's tracking these geese. So certainly when we look at the evidence of where does 0157 E. coli come
Yeah.
from, there's all this evidence about people finding it in geese. So sure enough, we go around, we look for geese, and we find geese.
Okay.
They're all over the place.
Yeah, like Canada geese?
Canada
Any
geese.
kind of geese.
Any kind of geese. And they can kind of spread it from animal to animal.
Okay.
And so we found some geese and we
Yeah.
tested them, but dang it, they were negative.
Okay.
Yeah.
So far, really still no idea what's going on or where it's coming from specifically.
Right, exactly. We have not found a
Right.
source. We've narrowed.
Okay.
Hopefully, we know that it's kind of at 1 mile, it's at the nature center, it's at 5 mile, or at least it was when we tested back at the end of July.
Yeah.
So it's probably upstream. So we know to not necessarily look around 1 mile or the nature center, but we're looking kind of farther upstream.
Right.
But yeah, we're working with the water board to do more testing right now. Hopefully, we're not only going to test the water again, see if it's still there.
Right.
Seems like a good question everyone wants to know.
Yeah.
Can we go back and can we swim again?
Right.
It's a beautiful creek. Everyone wants to
Everybody
swim in
wants
it.
to. Yeah.
But then we're also going to do more animal testing.
Okay.
So deer,
Yeah.
maybe other birds. It's kind of up in the air right now. We're kind of talking to different experts to really identify which species are around the park.
Yeah, interesting. And a good takeaway for people in general is that there are going to be things in natural waterways, and just wash your hands before, like if you're going to picnic, maybe do it before you swim. that
Yeah.
sort of thing, and
Yeah.
take a shower after, make sure your kids don't come in the house right after swimming somewhere and start touching everything.
Exactly. Everyone
Yeah.
loves to jump in the pool, immediately get out of the pool, and then pick up a piece of watermelon and eat a watermelon. Just try, when you're in one of these bodies of water,
Yeah.
try to wash your hands beforehand. And then I wouldn't go drinking it. Now,
Okay.
I've got a toddler. If I put that toddler in the water, she tries to drink all of the water.
Yeah.
So be cautious about small children like that who are
Right.
drinking way more water,
Right.
even when you don't think they are.
Okay. So, yeah, Butte County is something interesting. When I was looking at the last year's report, or every year we get reports about some of the big issues.
Yeah.
It seems like I've noticed in Butte County, cancer rates and obesity levels, both of those seem to be kind of high concern issues. What do you think's going? Let's talk about obesity first.
Yeah, obesity's tough. You know,
Yeah.
we're seeing a rise kind of throughout the country.
Right.
Our rates in Butte County are pretty similar to that of California. We're a little bit higher.
Yeah.
But certainly those rates are there.
Yeah.
Now, do we care about obesity? We do a little bit, but really what we care about is heart disease,
Right.
strokes. Those are things that kill people.
Right.
Obesity is a risk factor. If you are overweight, it can put you at risk for some of those conditions. But really the big things are things like diabetes, high
Right.
cholesterol, whether you smoke. Those are the real big risk factors that we get nervous about.
Theoretically, you could get type 2 diabetes and not be even overweight. Right?
Definitely,
And
definitely.
it's more, is it, I mean, linked to diet, a lot of it?
A lot of it is. You know,
Yeah.
I'd love to say that a large portion is genetic, but a lot of it is related to lifestyle.
Yeah.
So, you know, a lot of obesity and kind of treating diabetes and cholesterol, that's done at your doctor's office. That's
Yeah.
not done by the public health department. We
Right.
don't have any, doctors who are going out giving out cholesterol
Right.
medicines or giving out Ozempic and Wegovy.
Right. What
maybe
do you think of those?
I love them.
Yeah?
Certainly they have great research
Right.
associated to them. People are getting on these GLP-1s, Wegovy, Ozempic. They are losing weight. They are having less sleep apnea.
Yeah.
They're having less heart attacks. It's incredible.
I've heard that there is like talk about potentially using them for people who suffer from addiction too.
Yeah,
It's
really
interesting.
interesting stuff. Yeah.
There's a lot of gosh, we had a story last week about how people are repurposing drugs that have been approved, have been found to be safe, and then suddenly it's like, okay, well, like I think one of them was Viagra, actually, where it was like this was one that was meant for one thing, and then they found a different purpose. Or, yeah.
This happens all the time.
Yeah.
Yeah, there are countless stories of medications throughout, my career and even way back where they find a medicine and they're giving you a medicine. One great example for weight loss, some people don't know, is we give naltrexone, which is
Okay.
a medication normally we would give to people with alcohol use disorder
Oh.
or for substance use. But for some reason, when you put people on it,
Yeah.
they lose weight.
Right.
And you just find these things out.
Yeah, very interesting. I mean, addiction, that's got to be a public health issue.
Huge.
Not just in Butte County, of course, all across the country. And it seems like, especially when it comes to fentanyl, opioids, it just seems to be getting worse and worse. But, I mean, what can you do at a county level?
Yeah. Surprisingly, our county has done a lot. And we've started to see, overdoses from substances, usually fentanyl, but not just opioids. There are things like methamphetamine that we have issues with, which we're seeing a growing amount of people who are passing away from heart disease that we think came from methamphetamine use. But the county can do things. From fentanyl and opioid, it has started to come down. Now, why did that happen? We don't know for sure, but what we have been doing is we've been working with a lot of county partners to distribute naloxone.
Right.
Some people call this Narcan.
Yeah.
Yeah. So turns out if you get a lot of Narcan in the community when people are about to overdose, then they have Narcan close by and they can give it to themselves and they can not die.
Right.
And that gives them a little bit longer to get into treatment.
Okay.
A little bit longer to get to that point where they're ready to kind of come back
Yeah.
and kind of really treat that substance use issue.
What do you think about those like methadone clinics or options like that? I know that Orville right now they're looking at potentially there's like an appeal of an
Yeah.
Aegis center of sorts. I mean, are there enough local treatment options or ways for people to get off these dangerous drugs?
We talk about this a lot. There's a whole opioid coalition where we kind of just had a conversation the other day of, if someone comes into an emergency room and they're like, I'm ready to quit, can we get them in?
Yeah.
And right now typically they're seeing that they can get people into treatment within 1 to 2 weeks, which is pretty good.
Like locally? There are places? Yeah.
Yeah, definitely.
And what if they don't have money?
Yeah. There's a lot of different, that's where it gets complicated.
Yeah.
Are they eligible for insurance, and should we try to get them on insurance, or are there options where they could pay out of pocket on a sliding scale? Public health doesn't do a lot of that treatment, so I can't speak for sure on it, but all those options do exist.
Yeah.
Yeah. And generally, to your question, I feel good about those programs.
Yeah.
I know that some people go into those programs and they do them and then they relapse.
Right.
And that's a reality. But if we do it for 100 people, and 10 of those people go on to live a great life without any overdosing, and they get off substances, then I'm happy.
Yeah.
Yeah.
Okay. What do you think about the prescription drugs that are more severe? I hear it all the time that people who become opioid addicts, it started with the back injury.
Yeah.
And then it was Vicodin, and the prescription just continued for 6 months or a year or that sort of thing. Or, even kids who got into doing cocaine because they had ADHD and got Adderall. I mean, do you feel like that's a problem of overprescription? And do you think that we're seeing progress in the right direction with that?
Yeah, it's sometimes people, really, was it the doctor's faults in the beginning? I mean, people blame the pharma companies, but doctors were prescribing opioids all over the place because a lot of doctors just didn't know how addictive they were and they weren't getting good information. We have seen a huge drop in opioid prescriptions by providers in Butte County.
Yeah.
I did not do that work. That was done by the health department way before I got here, and that's incredible work.
Right.
And so we are seeing a lot less than that.
Yeah.
And I think we would have seen the benefits of that if we didn't then get hit immediately by fentanyl. And so, if we were just using prescriptions, then people would have had less overdoses, people would have been getting better, we'd be giving less of it into the system, but now fentanyl came back up.
Right. Yeah. Okay. Yeah, it's interesting. I know that you're not, you said that you did family practice a little bit?
Yeah.
Yes.
Yeah.
Okay. So tell me about that experience in general and compare that to what you're doing now.
Yeah, so primary care doctors are so important in our community. And when you're a primary care doctor, people come in to see you and they can bring in whatever issue they want. They come in and they're like, doc, my elbow's been itching for the past week, versus someone coming in and being like, I've been having this chest pain.
Yeah.
Two very different things. And that's kind of, having that huge scope of knowledge and being able to refer out the people that you're concerned about is similar to public health. We do a lot of stuff where we're kind of diagnosing a problem in the public, but we're not the ones that directly do it.
Right.
For example, water quality. We're not monitoring Lake Amador. We're not monitoring, Butte Creek at all times. But there are groups that are, and we can kind of refer out when we see an issue, like people are getting sick.
Okay.
Yeah.
As a public health officer now, what are your key areas of focus?
Right now, it's been there are certain infectious diseases which I think are very treatable that we could really address. Things like hepatitis C.
Okay.
Hepatitis C now has a cure, and it's very easy to cure it.
Okay.
And
What's the cure?
What's the cure? It's medication. You take medication.
There's
a medicine you take for
prescription medication
for 2 months, and then you're cured of this virus that can cause liver disease.
Yeah.
And not only that, to make it even better, I've got a whole list of people in Butte County, as the public health department, any time that there's an infection out there, it gets reported to us.
Okay.
We have Title 17 reporting. It's law that these labs and healthcare providers have to tell us when there's syphilis, when there's measles, when there's tuberculosis.
Yeah.
So I know when all the different hepatitis C people come in, I have their name, I have their number. We could call them. We could try to coordinate that.
Right.
And we could try to cure hepatitis C in Butte County.
Yeah.
Yeah.
It's incredible.
Yeah.
You mentioned measles. I wanted to ask you about, this is like a whole thing here.
Yeah.
What we're seeing with like the MAHA movement, right? And I've always been curious about vaccine safety in general because you hear so many things. You hear about mercury being in them.
Yeah.
You see parents feeling like, well, should I be doing this for my kid? What are we seeing, especially with the movement, with the changes with the CDC now? What are we seeing locally?
It's a great question. vaccines, regardless of whether you want to call them a vaccine, they are a medicine, and they should be studied. I mean, that's true. I think we can all agree on that. And part of those studies that we do is seeing if there is any issues with safety.
Yeah.
So for the COVID vaccine, for example, which is all the rage right now, they have done studies upon studies where they look at hundreds of thousands of people who got this vaccine.
Yeah.
And the risks are very, very low.
Right.
And now there is some discussion now at the CDC about, well, how effective are those vaccines? Should we be getting a booster every single year?
Right.
And I think those are good questions about how effective they are. But certainly from a risk perspective, they are extremely safe.
Right.
And we have seen time and again every season where if someone gets the COVID vaccine who is over the age of 65, it reduces their chance of going to the hospital,
Yeah.
of being in the ICU. And that data is pretty clear.
Yeah.
To your point, those conversations are happening at the CDC, and we don't know a lot yet.
Yeah.
Literally this week, they're going to be putting out a recommendation, the CDC is, on whether or not they want to recommend COVID vaccines.
Yeah.
So we're all looking out for that right now, and we're interested to see what they say.
Yeah, all of that stuff is so interesting to me because with these medications, right, there's so many variables. When you
Yeah.
talk about these studies, like I remember during COVID, that VAERYS reporting site was, a lot of people talked about that, and they would
Yeah.
think, okay, so they got a shot and then they had a really bad headache or they had a heart episode
Yeah.
a couple weeks later. Is it like correlation versus causation?
Yeah.
Like, how do we ever really know how safe something is?
Yeah, now we're really getting into the weeds here. But there are different.
It's a tough topic.
Yeah, but there are different ways that you can
Yeah.
study it. For example, you're right. VAERS is this reporting system where anyone can go on and say, I just had a vaccine last week, and now I just broke out into a full body rash.
Yeah.
And that information is helpful, but you don't know whether those people who are reporting, is that actually reflecting what's really happening? And so to do those types of studies, you kind of have to look at a group of people, all who got the vaccine, and you have to watch every single one of them go through.
Right.
We call this a trial.
Yeah.
Sometimes we'll even randomize it. And we can follow those people. We can actually see whether they have rashes all
Yeah.
over their body after a vaccine.
Yeah.
And that's kind of the most gold standard. Those are the studies that I really look at. Everyone can cite a study saying anything almost nowadays.
Right.
But those kind of trials are really what we're looking at.
Are you concerned about measles in school kids? I mean, I know that we've had some clinics and that there are certain requirements for kids going back to public schools. What are we seeing here?
Oh my God, Haley, this measles season was, a learning experience for me. Luckily in Butte County, we didn't get any measles.
Okay.
But there was a measles outbreak in Texas, and we were
Yeah.
very nervous about it. I think our health department got maybe 2 calls a week about measles. I've certainly never seen measles. So it's kind of hard for us to diagnose it, and so
Yeah.
we have to be very cautious about it. But I am concerned. Now I'm a little less concerned because we live in California.
Right.
And in California, for whatever reason, we have very good vaccination rates. We have all that data. So we feel pretty good about it. Now there's some groups that maybe don't get vaccinated as much, and so we kind of keep an eye on that.
Yeah.
But generally, I feel pretty safe here in California. I feel like my toddler, who's only gotten 1 measles vaccine, but even
Right.
before, can go out and play in the playground, and I don't have to worry about some kid with measles sprinting past and spreading it to her.
This is one of those once-in-a-lifetime ones, right? Like, if I had it as a kid, I'm probably good.
Yeah, technically there are 2, but the
Okay.
first one is so good
Right.
that even 1 or 2, I'll take
Twice
one.
in a lifetime. Yeah,
exactly.
but not like an annual sort of thing.
Exactly. This is
Right.
not like a MMR is the vaccine,
Yeah.
measles, mumps, and rubella. It's not a booster.
Right,
Yeah,
okay.
you get it one time.
So what's the deal with shingles? One of my coworkers just
Yeah.
got a shingle shot, and he
Oh
was
my
so
God.
sick. So I'm thinking, well, I don't know. I've never had shingles.
Yeah.
Do I want to go through that just in case?
Yeah.
Is it a big deal?
As a primary care doctor, these vaccines do have side effects, and this
Yeah.
is a great
Yeah.
example. Is the risk of a shingles vaccine worse than the actually catching shingles?
Right.
Because you are right. People get that shingles vaccine, and man, it can knock them out for a night. Sometimes I would give people doctor's notes after they get a
Yeah.
shingles vaccine,
Yeah.
just to, because they feel so bad afterwards. But if you talk to people who have had shingles, Oh
really
my
bad.
God, it can be awful.
And it's like stress-induced, right?
It's stress-induced, but sometimes it can pop up. It's extremely painful rash that comes from the old chickenpox
Right.
virus. And if you're lucky, you just get it on your body somewhere. But in some cases, you can get it in your eye, you can get it in your ear, and that can cause permanent damage. These are the things we get really scared about.
Viruses are so bizarre. They're like little,
know.
are they alive? They're like little zombies that like live in us forever.
Yeah, this is almost a theoretical question.
Yeah.
Yeah, I think
Do
technically...
they have a soul?
Yeah, I think they describe them as living, but yeah, what are they?
Yeah.
Yeah.
And what is the other one I'm trying to think of? Lyme disease,
Yeah.
right? And is that the spirochete or whatever? Is that a virus?
It is not a
It is
virus.
not.
Yeah, so Lyme disease, we see it way more on the East Coast, but it's
Okay.
spread by ticks.
Right.
Yeah, no, it's just another kind of one of these diseases that you can catch if you get bit by a tick. Now, we don't see too much of it in Butte County.
Good.
I don't think we've seen any this year. I don't think we even saw any last year.
Okay.
So it's very rare.
Yeah.
If someone out there sees any Lyme disease, please let me know.
Okay. Yeah. And hopefully we won't.
Yeah.
West Nile, though, we did have somebody die recently, and they were pretty young.
We did, yeah. And we were very familiar with that case. That's exactly the type of thing that the health department does. We get that reporting, so a lab reported to us that there was a West Nile case, and we go in and we kind of look at the case records and we look at what the doctor's saying to really see if it is West Nile.
Yeah.
Because certainly the majority of West Nile cases are asymptomatic.
Is it hard to test for? Do you
very
do like a
mild.
blood test?
No, it's easy to test for. It's more
Okay.
just nobody really tests that much
Right.
because it's very vague symptoms.
Right.
You get a fever, and you're like, am I sick? And you don't really know.
Right.
You're like, I think I'll wait a couple days, and then you feel better.
Because to repeat what I think you just said, most people who get it don't really have severe symptoms, and then some people have like crazy brain swelling.
Exactly. And
Yeah.
then some people, they can't walk.
Okay.
And so it's such a difficult balance for us.
So I guess my question about that is, because I know I've had summers where I've probably had 30 mosquito bites in
Yeah.
one summer, and then you're hearing these mosquito test pools, it's like, I don't know, 10 out of the 50 have it. So I'm thinking,
Yeah.
chances are one of them that bit me might have had it.
Yeah.
So if it's in your body, even if you're totally asymptomatic, could you have issues down the line? Like, is that virus in you forever?
We don't think so.
Okay.
So normally we haven't seen any sort of evidence that says that West Nile can persist in the body
Got it.
or causes any long-term symptoms. But again, we're not really testing that many
Right.
people.
Right.
But I don't think so. And sure enough, like when they do some of these studies, they go out and they check everyone's antibodies.
Yeah.
And they go into a county like Butte and they look and see how many people had West Nile. And it's a lot. A
Yeah.
lot of people had it and didn't even know it.
Yeah,
Yeah.
it's definitely a scary one because
Yeah.
you can do I love how many D's are there? 4 or 5 D,
Yeah.
dust, dawn, drain,
Yeah.
drain the water, all the things. But those little guys are going to get in your house sometimes.
Oh, yeah.
And it's just unavoidable.
Yeah.
So,
Yeah. Yeah, just trying to really reduce the amount of bites. Like if you can take it from getting bit 100 times when you're at a soccer game to only
Right.
like a couple times on your ankle,
Yeah.
that's huge.
Yeah. And I
Yeah.
think that people who are less sweaty get bitten less. That's
Now,
what I've heard.
Yeah, I've heard that too. I don't know where the current research is on that. Or like your
Or
blood
like you
type
eat less sugar.
Yeah.
Oh, yeah.
is always
Yeah.
one that I always hear.
Yeah, it's very interesting. I
Yeah.
know my son, my youngest son, is just like a magnet.
Yeah.
And so if I go hiking with him, I don't get any bites
Ah.
because they like him better.
Ah.
Yeah.
His name doesn't start with D, does it?
No. Yeah.
Just bring him along and he just attracts them from you.
The 6th D. Yeah.
Ah.
Okay, so you've been at Butte County Public Health. Most recently, now I asked you earlier before we started recording here about where were you during COVID, right? Because that would have been an interesting time to be in public health, I'm sure.
It was.
From your observations and where things stand now, I feel like I remember anytime I would ask Butte County Public Health, where do we stand with this order? It would always be kind of, hey, we go with the California Department of Public Health.
Yeah.
Is that sort of the go-to right now?
Yeah, it usually is. And so California Department of Public Health, we are certainly a local health branch, so we don't have all these experts who are reviewing all these trials and data that we kind of talked about earlier. Because it's hard. That's a full-time job just to review that type of information. And so we have these experts at the state who are so helpful, and they can kind of provide that guidance. In fact, we are seeing a lot of people in the hospital for this disease. And so they can give us those recommendations.
Yeah.
So they're very helpful. We appreciate all the guidance that they give.
Right.
For the measles we were just talking about, I call them up and ask them about measles a lot. Yeah.
So things have changed so drastically at the CDC in the last 6 months.
Yes.
How does that impact your job?
In a few ways. Certainly, we worked with the CDC on this E. coli outbreak, and they were incredible. So I don't want to say that the CDC is now, regardless of where you stand politically, in any way a bad way. They helped us with this outbreak, and that was incredible. But right now, I certainly wish that they would provide a little bit more information a little bit quicker. Right now, for example, if someone wants to get the COVID vaccine, can they get the COVID vaccine?
Yeah.
Will their insurance pay for it? Who should get the COVID vaccine? These are all questions that we are having to really figure out at a state and local level because simply the CDC hasn't released that information. Now, we think that they might at the end of the week.
Okay.
But still, we want to tell the people of Butte County, like if they want a COVID vaccine, where they can go get it. If I get called from a 30-year-old and he's like, should I get the COVID vaccine? And I'm like, well, the CDC doesn't have a recommendation out yet.
Right.
And so that stuff is, I think, can really add a little bit more work to what we do.
Yeah.
And yeah.
I mean, and it's interesting because I think that the governor last week or the week before said something about like joining some Western alliance with other states and like we're going to go with this guidance when it comes to making sure people have access to vaccines or whatnot. I mean, does that affect you and like how you do your job? Like, do you have an obligation to like, well, no, I'm going to go with CDC recommendations versus the state, or how do you handle it?
Yeah. So to make it even clearer, this is a unbelievable thing that's happening right now. You have the Centers for Disease Control, the federal agency which we all relied upon, who is maybe about to put out a recommendation that differs from what all of the major medical groups are doing.
Yeah.
So the American Academy of Pediatrics, literally all the pediatricians in the country have come out and said, we actually think that, newborns and children should get a COVID vaccine. And our expectation is that maybe the CDC doesn't. So it's weird times.
Yeah.
Do I necessarily have the clinical expertise to go look through all the research? I like to. It's one of my favorite things to do. But certainly that makes it difficult. And so at some point, we are waiting to see what the CDC says, but at some point we will have to kind of decide.
Yeah.
We'll have to decide, who do we trust more? And it's not even a decision public health has to make. Every one of your viewers, everyone listening to this podcast is going to have to be like, do I trust the CDC or do I trust a big group of pediatricians?
Yeah.
Or if you're pregnant. Like if you're pregnant and you're, about to deliver your first child and you're having to make a decision about whether to get the COVID vaccine, are you going to trust the CDC and the federal government, or are you going to trust thousands of OBGYNs who have come together and said, yes, pregnant women should get that vaccine?
Yeah.
That's the question.
Yeah. I guess, individual choice, right?
Yeah.
Yeah.
And certainly, that's something where the CDC does at this point in time say that it should be a decision between a person and their doctor.
Yeah.
Now, where it gets a little messy is who's going to pay for it.
Right.
And that's where some of these, what the federal government says, really impacts it. Because I believe that if a pregnant woman or a parent wants to get their kid a COVID vaccine, they shouldn't have to pay for it.
Yeah.
And so that's where things get really interesting. It's not just about whether your doctor recommends it, but will the insurance pay for it?
Right. What do you think about and this might be a little bit outside of the public health officer role, but you're a doctor, so I want to know what you think. This push to make drugs less expensive in our country, prescription medications that people need, like the people who are diabetic, the cost of insulin.
Yeah.
Do you think that these companies are charging too much, or should it be easier for people to get life-saving care?
I do. I'm biased because I treat patients, and not only that, but our public health clinic buys medicines.
Right.
And some of those medicines are very expensive. I think pharmaceutical companies would argue that they need that money for research, but I think time and time again we see where maybe that's not the case. A great example, syphilis.
Okay.
And this is an STD in our community. We have high rates of syphilis.
Really?
Yeah. We have high rates of syphilis. Not only that, but we have high rates of pregnant women getting syphilis.
Really?
And when a pregnant woman gets syphilis, a lot of times I have to give them 3 doses of penicillin.
Okay.
That penicillin is running me about $2,000 a pop. This is a medicine, was the very first antibiotic to ever be created.
Yeah.
It should be well off patent. I should be paying cents for it. But instead, we have to decide, you know, are we going to pay $2,000 for these shots?
Yeah.
No, we do.
Right.
But
Right.
it's terrible.
Yeah.
And then we talked about obesity earlier. Things like Wegovy, Ozempic, you know, those are very expensive
I've heard of
medications.
that. Yeah.
But if everyone got access to those medications, we could see a tremendous population health benefit.
Yeah.
But they're too expensive.
Yeah. Interesting.
Yeah.
We'll see what happens.
Yeah.
So let's see, what was I going to ask you about? Oh, access to healthcare providers in our county.
Yeah.
It seems like a lot of different counties are kind of seeing the same issue, right? And every time I have a doctor's appointment, I ask my doctors, I'm like, why do you think not a lot of doctors are here? And I've had some tell me, well, actually, this sounds kind of weird, and I hate to say this, but doctors want to live in like more upscale places.
Yeah.
I mean, do you think that's a real issue behind the healthcare provider shortage?
I don't know. Sometimes you'll hear this, like
Yeah.
how doctors, you know, I want to be close to an international airport
Right.
or something like that.
I mean, fair enough.
Yeah.
I like flights out of Chico, but
Yeah.
anyways.
In reality,
Yeah.
I think, you know, they're in a way correct in that doctors are not going to go move out into the middle of nowhere that they've never been before.
Yeah.
So it's important to expose people to Butte County.
Right.
So how do we do that? You know, right now, Butte County is in a really interesting spot where we're doing things. Butte County now, as in the past 2 years, has 3 new medical training programs, 2 for psychiatry and 1 for family medicine. And so these individuals who are coming in to train in these positions see Butte County. They see how wonderful it is. They're like, wow, you know, I really love going up to Butte Meadows. Well, I really love taking the boat out on Lake Oroville. And then they're like, you know what, this is not a bad place. I'm going to stay here.
Yeah.
And that's how we get them.
Right.
That's how we get them to stay.
Yeah.
And so that would be my pitch, and it seems like we're making progress there, which I'm really excited about.
Okay, so you feel hopeful the more with the residencies and just, is it a public health campaign like issue too to get the word out? Is that kind of falls under your purview?
Yeah, you're right, because we don't do any training programs ourselves,
Right.
but certainly we kind of are on committees, and part of our improvement plan that we put out is all about access to care, aka can people go to the doctor and get in. It's not just doctors too, we're talking nurses, we're talking about physical therapists, we're not talking about primary care doctors, but specialists, rheumatologists, nephrologists, kidney doctors,
Yeah.
those types of things. So we are very, you know, we may not be the ones training them, but we are very supportive
Yeah.
of all of those groups. And, you know, and I will say, it takes doctors to train other doctors. And so we are in an interesting spot where a lot of doctors in our community may need to commit to helping train the next generation. So the next time you're at your doctor's appointment, don't ask them why they're not other doctors here, but ask, are you training your replacement?
Yeah.
Where's the person
Yeah.
who's going to take your job?
Yeah.
Because I want to see them in here.
I like that. I'm always thinking about that for myself.
Yeah,
Kind of. Yeah.
exactly.
Or at least who can be my replacement so I can take a day off and go on vacation.
Exactly.
You got to think about that.
Exactly.
Okay, so another thing that I see as a huge issue, I don't know how specific it is to Butte County, but this mental health crisis.
Yeah.
Right? I mean, it seems like life has never been easier.
Yeah.
Like I have a Roomba robot that vacuums the floor when I go off to work. Like
Yeah.
my house can be hot or cold. Creature comforts are everywhere,
Yeah.
right? We live in this time where it's like it's being encouraged. It's okay to not be okay. Talk about your feelings. Like,
Yeah.
and yet it seems like people are more than ever more anxious, more stressed, more depressed, more miserable. What do you think? What do you think is driving this?
Yeah, I mean, certainly I'm not an expert. I'm not a psychiatrist. I'm not a therapist. But as a family doc, you know, you see people come in, and the majority of psychiatric medications are prescribed by family docs.
Yeah.
So we see a lot of it. I mean, could it be income related? Could it be cost related? Like people are you go to the grocery store and things are just getting more and more expensive. So there's all those kind of real world things that are really stressful.
Yeah.
There's also, I mean, I think there's a growing body of research that everything that's happening online, the social media, kind of being constantly connected to our phones, that could be hurting us.
I think social media has such a huge role in so many of our problems right now, not to be biased. And honestly, the media in general is a huge stressor.
Yeah, yeah. I agree. And certainly, you know, therapy is one of those things, and we don't have enough mental health providers.
Yeah.
We have, in Butte County, an amazing behavioral health department. They have psychiatrists, they have therapists, they are providing the services to Butte County, and that's all community funded. That's all everyone's tax dollars, which is really exciting. And then we have the new 2 training programs, so certainly we're getting a little bit of extra support.
I've noticed something before that I never was available to me in the past when I would want, if I wanted to do therapy for whatever reason, I'd have to basically just pay out of pocket. My insurance didn't cover it. Now, recently, I was kind of thinking about, okay, how do I get into therapy and get my insurance to cover it, right? And when I told them initially the reason, I said, oh, you know, like family therapy, like, you know, stuff with my husband or my kid, whatever, nobody would cover me. But if I told them something else, like more of a medical, oh, I'm feeling depressed or whatever it was that I told them, then suddenly, oh, that's an insurance issue. So just a note to people at home, like your insurance might cover it. You just have to kind of, I mean,
you got to play the game.
Mental health is a health issue, right? And it should be something that our healthcare cares about.
Our health department has a kind of a program that works on suicides and things like that. So we do have a little foot in the door there, and we're concerned about it. And I think we're hoping that this is such a resilient community. And I think that if we can kind of slowly bring in more providers, if we can slowly kind of all think about it as a community, like how we can address things like social media and things like that. I think we're on the right path.
Okay.
Yeah.
Do you think, one other question on the mental health issue, I've heard stories about people who go on antidepressants or get addicted to their Xanax, or they go on an antidepressant and it's like they can't go off without, I've had friends that became like kind of schizophrenic after trying to get off of a antidepressant and maybe doing it too quickly or whatnot. I mean, do you have concerns about overprescription with that sort of thing, overdiagnosis?
Yeah, I don't know the data about like where kind of prescriptions are, especially for Butte County. It's not something kind of we track regularly. But certainly, like, there are a lot of tools in the toolbox for mental health, and you know, any good psychiatrist will tell you that medication should happen after you try the other stuff. You know, exercise, after you try to kind of do stress management, after you go to therapy. And then if those things don't work, medications. Now, there are some circumstances, if people are feeling really bad, that we go straight to medicines, and that's just for safety. As for getting off, you know, this is always an area of debate. There are some medicines that are easier to get off than others. There are certain side effects for those medicines. Those change based on the person. So it really is that, again, that kind of conversation that has to happen between the patient and the doctor, because there's so much variation. You take a medicine and you might have no side effects and be like, that's the best medicine I've ever had. And then someone else takes it and they're like, what? That was awful. That made me feel like a zombie.
Right. Trial and error kind of.
Exactly. And we have no crystal ball that tells us whether someone's going to have a side effect from a medicine. And it makes it kind of difficult. And some people will say, you know, well, I don't want to be a guinea pig.
Right.
And that's
unfortunately,
that's life.
Right?
We just don't know.
I mean, you go to a restaurant, you try something on the menu, and it's like, you're a guinea pig, right? I don't know if I'm going to like that filet mignon or not. So it's all trial and error.
Yeah. I will say public health does inspect restaurants.
Okay.
So hopefully, though, whatever meal that you try is perfectly healthy for you.
How are our local restaurants when it comes to cleanliness? And,
excellent.
Yeah?
Yes, they're very good. You know, luckily we've got a good team that kind of goes out to restaurants. They're very responsive. They're able to work with restaurants to see if they have any issues. But generally, we have very clean restaurants.
Okay.
Yes.
All right. What are some of your favorites, just personally?
Yeah. So, you know, kind of coming in, you know, I drive down 32, and there's this gas station, and attached to the gas station, there's this place called Gordo Burritos.
Oh my gosh, my boys love that place.
Oh my God, it's incredible. It's just like part of a gas station. I love it.
So I was expecting, because you're from the East Coast, right?
Yeah.
I was expecting some sort of like pizza place or something. Is there any good pizza that compares to East Coast pizza?
You know, I haven't been to too many pizza places here.
Yeah.
So I think the jury's still out on that one.
Okay.
Yeah.
I've heard Celestino's is a really popular one.
Oh, now you're really testing my knowledge.
Oh,
I
you
don't
got to
know.
try it.
Celestino's.
Yeah, there's a couple in Chico, but probably the closest, easiest access one is like downtown, right by Chico State.
Interesting.
Right near Tres Hombres.
Yeah.
You got to check it out.
You eat there or you bring it out?
You either. You
Eat
could,
there.
yeah, it's not a fancy place. It's like you could
okay.
buy it by the slice. Like you could go right now after
Yeah.
this podcast. Maybe Lisa should take you over there.
Oh, nice, nice. Excellent.
Yeah, I'm a big pizza person.
Oh, cool.
So, you know, what else? How do you take care of your mental health? Like on your time off when you're not trying to protect everybody else?
Yeah, I mean, I get to explore Chico and
Yeah.
Butte County, which has been a blast. You know, even though we say not to swim in the creek, you know, I've been walking in Bidwell Park, which is gorgeous. It's like a whole forest in there. We do a lot. I go up all the way up to 5 Mile, and that's a blast. Going to the farmers markets in Chico, going down to Orville and kind of seeing the dam and the water there. It's really nice.
I feel like people who can engage in these kind of like community things
Yeah.
and have this appreciation and get value from their surroundings and the place that they live, I feel like that contributes to overall health and wellness. You hear about that. People
Yeah.
having good relationships and good life experiences can just make you healthier.
Yeah, we just need to get people out
Yes.
of their houses.
Yeah.
Go knock on everyone's door.
Oh,
Be
there's
like,
so
"Come
much on
out."
Netflix though.
You come home after work. It's so easy to sit down.
Yeah.
Turn on that TV show that you've seen already twice.
Yeah.
Yeah.
It's funny though. Have you heard of this study? It might have been Harvard, and it was like a study over the course of like 75 years or something, where it was all about what is the biggest contributor to longevity, and it was relationships. Have you heard about this one?
I mean, I've heard things like
Things
that, and
like
I
that.
believe it.
I find it to be so interesting that it is,
Yeah.
you know, just hey, do you have good relationships with your neighbor, with
Yeah.
your family? It's so important.
Which takes work. You know, that means you
Yeah.
got to call them. That means you got
Yeah.
to set up that time to go see them.
Yeah.
It means you have to drive there. You know.
I try to implement little tricks, like every morning maybe just text someone I haven't spoken with in a while and just send them like just thinking about you, you know, like
Yeah.
little things. It lifts you up, it lifts them up. Yeah, I think we can do a lot to help each other,
Yeah.
you know.
I agree. Say hi to people when you see them in public. Try
Yeah,
to make
that
new
smile to the stranger in the grocery store.
Friends. Yeah, incredible.
So what are some, we talked about a lot of things I'm concerned about with public health.
Yeah.
Anything I didn't ask you about that you think that it's kind of maybe your goal for this year or you want people to be aware of?
Yeah, I mean, certainly, like, before me, there was a couple health officers that were not around. And so everywhere I go, I'm trying to encourage people to really engage with us as the public health department. You know, we are Butte County's public health department.
Yeah.
We love to hear from people. I talk to people all the time. People are constantly giving us, you know, feedback, which we really appreciate. And then, of course, people are reporting things to us.
Okay.
You know, like if someone is feeling sick after they go to a restaurant, they should reach out to us.
Yeah.
If someone goes swimming and gets sick, they should reach out to us. You know, we like to hear all that stuff.
Speaking of people being sick and out and about, I deal with this dilemma all the time because I was raised of the generation where, you know, if I was sick or whatever, my parents would tell me to toughen up.
Yeah.
You're not going to skip school just because you're feeling a little. So I have this reaction if I start to feel like I have a little bit of a cold, like, oh, I can't let my team down. I
Yeah.
got to be there. I can't just, you know, skirt my responsibilities. But then you see the cold getting passed around to like everybody,
Yeah,
right?
yeah.
I mean, is there, but if every time you had a stuffy nose, if you didn't go to work, nobody would ever go to work ever.
Right.
Where does public health stand on that?
Right. I mean, currently, it's a great question because currently the recommendations from the state health department is
Yeah.
if you've got a runny nose, if you've got respiratory symptoms,
Right.
you should be out for 3 days.
Yeah, okay.
And that's huge compared
Yeah.
to where we were, 10 years ago?
Yeah.
Where you would just go.
Right.
I think, you know, one of the reasons that they'll say is, you know, maybe you decide you're gonna go to work. You're like, I could toughen through this. But then you give 2 other people, and then they give 2 other people, and then they give it to their grandmother. You know, so it's hard to really quantify, like, what impact are you going to have by doing it?
Yeah.
Luckily, we live in a time where you could do a lot of stuff remote, and so if
Yeah,
you're
that's
like
true.
really in, I feel great, but I know that I'm going to spread an infection. Maybe I could try to work from home if you can.
Yeah.
But certainly, like, if people are feeling bad, they should be able to take a day off.
Right.
It's not, sometimes they don't have that arrangement with their employer, but I certainly think that they should.
Yeah.
If you're an employer out there, they should be making sure that people have paid sick leave.
I like that point you made too about the working remote. Because, I mean, a lot of, especially like even in my industry, if
Yeah.
a reporter had a little bit of a cold, but they felt well enough to work, they could do a Zoom interview with you and do a story about the latest on whatever public health's doing, and they can
Yeah.
do that all from their house, right?
Exactly.
We have a lot of tools today.
Exactly.
Yeah.
We're in a good time.
Yes.
Yeah.
Uh-huh.
Or you don't have to spread it to someone. Yeah. And then there's stuff you could do. I mean, certainly if you want to show up to work, I mean, most respiratory diseases are spread, by aerosols, so you could put on a mask.
Yeah.
You could wear a mask. Making sure to wash your hands, maybe a little bit more than you would. Normally people wash their hands when they go to the bathroom, but maybe you wash your hands a little bit more than that when you're not feeling well. Kind of take those additional measures.
Okay. We're getting to the end of the time here. I have one question I wanted to ask you, though, about, especially as we get into cold and flu season. Using antibiotics and antivirals, like every time you have a little cold or whatever, do I just take a Z-Pack?
Yeah.
Does that make things, are the superbugs, is that something you're concerned about? Do we overuse antibiotics?
Haley, I am so glad you asked that because it really is a big issue. There are multiple antibiotic-resistant bugs, bacteria that are they've kind of all been in Southern California. They're moving northward. We're seeing more and more of this. People may know this. Their family may go to the hospital for something and they may get diagnosed with something that is resistant to so many antibiotics. One of the big reasons for that is... Sorry.
I have an alarm going off. We're going to talk right through it. Go
Okay,
ahead.
cool.
Yeah.
So one of the big reasons for that is, because people are taking too many antibiotics. And in general, if you have a little bit of a cold, if you even have a little bit of a cough, but you're not having a lot of fevers and you maybe you feel crappy, but you don't feel like you have to go to the hospital.
Yeah.
Those people probably don't need antibiotics.
Yeah.
Now, that should be a discussion with your provider.
Right.
But in generally, a cold can last a week, 2 weeks, and as long as people are not getting worse, we typically don't recommend antibiotics.
Okay, let's keep those superbugs out of Northern
keep those
California.
superbugs out.
Boost your immune system, good health, right? Rest, sleep,
Yes,
water.
exactly.
Stay home,
Yeah.
and we'll get through cold and flu season together.
I love that.
Okay.
And certainly if a provider tries to give you an antibiotic, let me know.
Yeah, okay. We'll have the conversation about it. Dr. Beaudoin, thank you so much. It's been a pleasure having you out here, and
Yeah.
great getting to know you.
Yeah, thank you so much,
Yep.
Ellie.
Thanks for listening today. I decided to offer this podcast after enough of you let me know that you wanted a deeper dive into certain stories than you get on our TV broadcasts. We elect certain people to represent our voice, but who are they really? My hope is that this podcast answers that question. I love your feedback, and I want to know who you'd like to hear from next. Just fill out that comment section and leave us a review on Apple Podcasts, YouTube, or Spotify.